Huge news out of the state of Arkansas today with the passing of Arkansas Bill HB 1150. I cannot wait to talk to you about this on This Week in Pharmacy, April 18th. It is a good day in pharmacy. So, with that, let's get started with This Week in Pharmacy. Holy smokes. As a guy who's been paying attention to PBM reform, more specifically and more intently, right around 2018, because to tell you the truth, I had no idea what a PBM was or how they acted. I heard about them. And then when we released the PBM Reform podcast in 2019, I started recruiting pharmacists, pharmacy owners, lawyers, people in our national associations who really understood, hey, we know very well, we know that PBMs are disruptive to access to healthcare. They're disruptive to pharmacy ownership and creating jobs in communities. They're disruptive to public health. So we like an evidence-based environment where we bring in experts, we bring in people to talk about issues. And today we're going to be focusing and jumping on Arkansas Bill HB 1150. And I want to invite a pharmacy professional, someone I've known for years, Lelan Stice, to the show. Excited to have you here, Leland. Excited to be talking to you about this huge win in the state of Arkansas. Welcome to the show.
Yeah, thank you. Good morning.
Good morning. So tell the listeners just a little bit about yourself, just to get us going before we get into the bill 1150.
So I've been working in pharmacy since about 1983. Started in high school as a technician before we had PBMs, and 90% of prescriptions were cash, no insurance. And got into pharmacy ownership in 2009. Spent the majority of my career in hospital pharmacy administration, director of pharmacy, clinical programs, that sort of thing. Been in the retail scene for, well, we're closing in on 20 years, 4 more years to go.
It's a long time. It went fast, didn't it?
Yeah, very fast.
All right, let's talk about this incredible news. The report that just came out today, actually just came out yesterday, and it was from Drugstore News. And the headline is CVS may close stores in Arkansas following law banning PBMs from owning pharmacies. HB 115 prohibits state permits to pharmacies owned by pharmacy benefit managers, and that'll be effective January 1st, 2026. If we thought about this in other terms, if we said to the lay person out there, the consumer out there, that the insurance company gets to make the decision about your care, and then they push business to pharmacies that they actually own, I know, you know, and the lay person, the consumer knows that that is a conflict of interest, and I have no idea how it is even, and I don't even know how that's happening in the United States of America, that we allow this to take place. But what's your feelings around this amazing announcement that came out this week?
Yeah, exactly. I mean, this bill was designed specifically to eliminate that conflict of interest of the payor owning the pharmacy and, setting the price that was paid to the pharmacy that is an independent, but also setting the price for themselves. And we see them paying themselves more, but it's more about patient care and patient access. We've had, because of this vertical integration, eliminating this conflict of interest stops the steering in Arkansas of patients being steered to specialty pharmacy. We know 70% of cancer and specialty drugs are going to 3 pharmacies owned by PBMs. Patients want to be able to get the prescriptions right here at home and not have to wait for it to come in the mail wait for, weeks of processing. It was very interesting that one of our biggest proponents and backers for this bill was two cancer institutes in the state of Arkansas, Carti, and I'm forgetting the name of the other one, but both of them came, testified at the Senate hearing and the House hearing on how difficult it is for them to get patients treated quickly and safely. And that's a big piece of what this bill is about, is patient care, patient access, and not being forced to be steered to a pharmacy out of state, or being forced into mail order, those types of things.
Yeah, research has shown that mail order and dumping a 90-day supply of medications into a box and throwing it into a hot box mailbox and having it bake all day long at 127 degrees is not in the best interest of the actual compounds in those medications for the
Right.
That's just one issue that's come up that
Just one, yeah. And you get in the South, those trucks get 140, 170 degrees inside the back of them.
Absolutely. So it says Arkansas Governor Sarah Huckabee signs on April 16th HB 1150 into law. The legislation prohibits state permits to pharmacies owned by pharmacy benefit managers. Following the news to legislation passage, CVS Health announced it may be forced to close 23 stores in Arkansas. CVS Health provided drugstore news with the following statement. It said, CVS Health welcomes a good faith discussion with policymakers in Arkansas and across the country on ways to make medicine more affordable and accessible. Unfortunately, HB 1150 is bad policy that accomplishes just the opposite. It will take away access to pharmacy care in local communities, hike prescription drug spending across the state by millions of dollars each year, and cost hundreds of Arkansans their jobs. This is complete bullshit. It's bullshit. That statement, I'll just come out and say it. This is an adult show. And the reason it is because we know that since the institution of the control of the three largest PBMs, that costs have gone up every single year, but profits have gone up every single year. And we've seen less and less and less access to medications for people that need them, including in the state of Arkansas. And we've seen the disintegration of our community pharmacies, our independent community pharmacies that have been staples of the communities for 50, 70, 100 years. And now they're not able to serve the community, and they want people to be pushed to CVS. Listen, I don't have any problem with CVS Health. I don't have a problem with Walgreens. I don't have a problem with any of the chains. Right. I have a problem with not being able to be on the same level playing field and giving the consumer the power of choice. What this statement really says from CVS's nicely crafted public relations message is that they can't play. They cannot play ball with community pharmacies throughout the state of Arkansas on the same toe-to-toe. They know they're going to lose, and they know they're going to lose to if there's a community pharmacy across the street and there's a CVS. I know that they're both going to have business, as they should. They should be allowed to have business, but it's that local community pharmacy that forms the relationship with these people, knows them generation after generation. Helps the local ball clubs, helps the local bowling, alley clubs, does things in the community that has nothing to do with medication management. But the opposite is happening across the nation, the shutting down of our independent community pharmacies. Therein lies the statement. You could badge this exact statement that CVS made and put on NCPA's statement, and basically it would be true if NCPA came out and said it, because it is prohibiting access to medications, because we're seeing pharmacies get closed down in the communities that they need to be serving. So what do you think of the bigger impact that Arkansas is going to have? Because guess what? Ohio's already on it. Pennsylvania's already on it. Florida is already on it, and they're paying attention.
Yeah. So I guess one thing I want to say is Sarah Huckabee Sanders is the GOAT. To stand behind independent pharmacists and pharmacists in general. I mean, the pharmacists that are at CVS and other PBM owned pharmacies are great people.
Yep.
They want to be able to do the same things with their patients that we do in independent. Um, Tim Griffin, our Attorney General, drafted a letter and has 38 other state attorney generals that signed on. That got sent to Congress this week that asked Congress to put the same language that is in HB 1150 into federal statute. That is what we need. We don't, every state having to do it one at a time is a long, arduous process. We need the federal government to step up and act on this and give access back to patients. Stop this exponential inflation of drug prices that started in the late 90s, and it's just outrageous, the price of insulin these days. Insulin used to be $35. Now it's $300, $400, $500 for maybe a month's supply of insulin.
I want my physician and I want my pharmacist to make decisions collaboratively together so
Right.
that my health is taken care of. When you have the model that's in place today within 49 other states that allow an insurance company to dictate what my physician and what my pharmacist want to do based on frivolous prior authorizations and denials right from the get-go that have absolutely nothing to do with patient care and have everything to do with profit. That's why I'm cheering this bill, because
Yes.
now removing the artificial, it's artificial. You remove the artificial insurance entity from patient care. You allow it to be what it's supposed to be, which is insurance. It's not supposed to dictate my care. And now my physician and my pharmacist get to step back into the state of Arkansas's patient care and really start to dial into what an individual patient needs. And that individual gets to choose, do I want to go to CVS? Do I want to go to Rite Aid? Do I want to go to Walgreens? Or do I want to go to my independent community pharmacy that's right down the road that supports my community and been there for years? So I love this bill. I cannot wait to see Governor Sanders speak to other governors throughout the country and saying how this will impact, where I can't wait this time next year to be able to see the outcome of this. And if we see the shutdown of CVS pharmacies, I mean, that's the economy. That's the economy working. That's the free market working. But to have an artificial piece of a business model in place where it forces a patient to use a specific pharmacy, not get the access, not have a pharmacist to talk to, get their 90-day supply in the mail, bake it up in 140 degrees heat. None of that makes sense.
Right. And this bill does not require CVS to close their pharmacy.
True.
It just requires them to separate them from being owned by their PBM side. And they've talked about doing that in the past. And we are very hopeful that CVS plays nice and helps us transition these pharmacies if they decide not to divest them from their PBM side, and help us transition the care of these patients back into the local community and to local specialty pharmacies that exist right here in the state. There's mail order here in the state if the patient prefers that.
Exactly.
We just want them to play fair and play nicely and not do something that's going to harm patient care by scorching the earth and just shutting the stores down overnight and making it a free for all. It's not the right thing to do for patients, and hopefully CVS sees that and acts properly.
Absolutely, absolutely. Lelan, this has been wonderful. You took time out of your day to hurry up and jump on to be able to talk to me about this incredible announcement, HB 1150, prohibiting our insurance companies from owning pharmacies, as it should be. Hope to see you at a national conference upcoming, maybe in the fall. What else is happening with Doctor's Orders Pharmacy that you'd like to share with the listeners?
Taking care of our patients and, trying to do the right thing every day and be there for them 24/7.
Well, we appreciate you and what you do. Very excited about Arkansas's progression in saving patients access and fairness to the choices that they should be making in a free world, and Arkansas is doing it right. So shout out to Arkansas and shout out to you, Leland.
All right. Thank you.
All right.
Have a great day, Todd.
See you later. All right. We will be right back for more on This Week in Pharmacy. Just stay tuned.
Advocates say Texas pharmacies are facing a crisis. Many forced to close due to powerful companies driving them out of business. KVU's Jessica Cha spoke with a local pharmacist about how these closures could affect patient care.
34 years of taking care of the community.
I'm gonna fill a script.
1,000 patients helped.
Are you going Easter egg hunt this weekend, Milton?
But business is more than the numbers to 38th Street Pharmacy in Austin.
They keep us, in business, and then also it's a relationship that we've developed over the years with a lot of them.
But numbers do matter when it comes to staying in business for Matthew Warnkin and his family.
It's really difficult to be sustainable and stay alive when you're selling your products under what you get paid for.
He's talking about what's happening with pharmacies and pharmacy benefit managers, or PBMs. They're third-party administrators that manage prescription drug benefits for health insurers. They can determine how much meds cost and how much pharmacies get reimbursed for providing them. Morgan says 80% of their customer base is covered by just 3 PBMs.
If I don't sign one of those, I could be out 30% of my patients.
But Warnkin says PBMs are shortchanging them.
Medication cost, $800. We get the prescription, fill it, submit it to that insurance company or the PBM, and they'll, pay us sometimes as low as like $650.
He says they're eating the cost and losing money every day to provide some of these prescriptions.
Keeping brand name meds on the shelves is getting expensive. Too expensive for some pharmacists. According to the TPA, one pharmacy closes their doors a week in Texas.
It's affecting chain pharmacies. It's affecting independents. It's in rural areas. It's in urban areas.
Roxanne Dominguez is the CEO of the Texas Pharmacy Association, a group that advocates for pharmacists. She says sometimes pharmacies are the only place people can get any kind of health care.
If you think about like the rural Texas where there's a pharmacy desert and there's nobody around, that's going to be their only place to go for help.
She says they're working with legislators on PBM reform legislation for customers like Milton Boyd, who would be in trouble if 38th Street Pharmacy closed.
It'd be like closing my HEB. Seriously.
To keep counting on taking care of the community. In Austin, Jessica Cha, KV News.
All right, I tell you what, This Week in Pharmacy, covering pharmacy news and how important it is to stay on top of PBM reform. You know it better than I do. You're out there, you're working a pharmacy, you're a technician, you're a pharmacist, you're a pharmacy owner, and you're struggling to keep in business, to stay in business. Continuing with news, we have from the Sacramento Bee, California AG Rob Bonta urges Congress to ban middlemen from owning pharmacies. We know, based on our interview that we just had with Lelan Stice, that owning pharmacies and an insurance company and having those together is not in the best interest of consumers. It is against Stark law. Nobody wants to admit it, but it is. And it's making national news everywhere. I guarantee we're going to see more states like Arkansas take a note and not allow PBMs to own pharmacies and be a PBM. You cannot be an insurance company and own a pharmacy. You cannot be an insurance company and own a bunch of physicians. It's just a conflict of interest. And you as a payer, you as an insurance provider should not be in the healthcare you should not be in the healthcare delivery business. You need to stay in administration, stay in your lane. Other news, and just a shout out to Drug Topics, which did a great piece this week on the importance of vaccination to independent pharmacy profitability. And we were excited to read this. And if you're watching us on YouTube, you'll see on your screen the actual article came out on the 17th of this week. And it goes into the AAP 2025, which is a buying group for independent community pharmacies. Greg Mitchell's the owner of United Drug Superstore, and he discusses how retail pharmacies can leverage vaccine services to build long-term patient relationships and how important that is to your community, education to your community, the trust of your community, vaccine rollout, immunization rollout.
It's been huge for us. It
comes along with it. I think that this is such an important part of your services as a community pharmacy and what that means for your community. I want to listen to Greg Mitchell.
It's been huge for us. It's been amazing. We jumped into the vaccination business in 2020 before the COVID vaccines came out. We were very fortunate to have be one of the states that our wholesaler supplied the federal supply of vaccines to. And we jumped right in with both barrels and finished that year with about 5,800 vaccines. And the profitability that year was well above anything we'd seen in previous years. What we look at now is that typically if vaccines are 5% of our business, they're 10% of our gross margin. So that tells you that it's very significant. Well, that was a question that I had after looking at the deck that Scott shared with us today, when I saw that another class of trade was actually up in vaccine administration, where our stores, independent stores, all seem to be down. My store was down 30% this last year. So we went into some of the grocery stores to see what was going on, and they did a fantastic job of point of purchase advertising. They had advertising when you walked in the door, advertising when you picked up your cart, advertising on the end caps, advertising at the checkouts to try and get they call them customers, we call them patients, try to get them over to the pharmacy. But for us, we've got to really concentrate on doing that this next year. The other thing is you can mine your state immunization information system database. We've started doing that in the last 3 months, and we've had a huge uptake. We're actually calling the patients and saying, hey, we see where you got your first shingles vaccine, you didn't get your second one, we need to get you in here. And that's really bringing people in. So we are concentrating on having our staff mining that immunization information system. Every time we fill a prescription for somebody, let's look at their deal and on the state shows exactly what they're due for, and then we're going to call them and say, hey, when you come in, you might want to get your COVID shot or your second Shingrix or whatever it is. So that's been tremendous for us.
So shout out to Drug Topics for that great coverage and that story about immunizations. I will have a link in the show notes to the article, Importance of Vaccination to Independent Pharmacy Profitability. And a shout out to AAP, the American Associated Pharmacies, for being part of that story. Hey, you are an important part of the Pharmacy Podcast Network. Thank you for being a listener. But a shout out to you. If you would like to start a podcast and you are a pharmacy professional, you're a pharmacist, you're a technician, you're a business person in pharmacy, we are expanding services through the Pharmacy Podcast Network to support you and to bring you listeners and to bring you recognition and connect you to the right audience. This has been a strategic move for us in the second half of 2025. So reach out to me. Ask about using our turnkey services and helping you to build a production high-level podcast that also brings you immediate listeners. If you don't understand podcast metrics like I do, goodness gracious. When I started 2009, 0 listeners. It's taken 16 years to accumulate over 80,000 consistent listeners month after month after month, and we see it growing. And that's because of the collective. That's because of our specialists. That's because of our themes. That's because physicians, pharmacists, nurses, and business people come to the Pharmacy Podcast Network for all content under the umbrella of our pharmacy profession. And we are leading on purpose with content that is high-level education, continuing education, white paper, audio white paper like pieces of content to support your organization. So if you would like to get involved with the Pharmacy Podcast Network, you heard it here on our TWIRx episode on TWIRx 2025 on the April 18th, that we are announcing a call to pharmacists and a call to business professionals and technicians. If you want to join the #1 leading podcast in the entire pharmacy profession, the pharmaceutical markets, join the Pharmacy Podcast Network. Reach out to me. Go to publisher@pharmacypodcast.com. Once again, that's publisher@pharmacypodcast.com. Send me a message. Tell me that you're interested. We are recruiting people heavily right now for all kinds of different subjects, and we would like to have you become part of our network. And we haven't done this before. We've been very specific about the host, and we will still be very specific about content that we're putting out, but nonetheless, we want to expand. And the only way that we're going to expand is by people like you who are passionate about our profession, passionate about pharmacy care and the excellence in pharmacy care. I'd like to see someone come to the Pharmacy Podcast and talk about artificial intelligence all the time, or talk about technology, or talk about disease state specific management. We have so many podcast hosts already that are focused on specific themes. If you'd like to learn more, please go to pharmacypodcast.com. Once again, that's pharmacypodcast.com. And we are going to wrap up news today, but stay tuned because we have a special episode with a partner of ours that's helping us get to Asembia, and that's Lumacera Health Services. And we'll be right back.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, and we are back on This Week in Pharmacy, and guess what? It's Viva Las Vegas time because we are headed to AXS25. By the way, I thought that was pretty clever when the team at Asembia came out with the new title AXS, and I used to say AXS like a dummy, and it was Access. So it's Access to Pharmacy, AXS25, the biggest specialty business conference in our industry. It's one of my most exciting events. This will be our 9th year covering this show. Back in the day, it was called Armada for you people that are getting old like me. And it's just a gathering of all things business and specialty pharmacy, where we're all going. Very excited about the speakers. It's going to be at the Wynn Encore Las Vegas, April 27th and May 1st. If you are listening to the program right now, This Week in Pharmacy, and you would like to be part of our press coverage, please reach out to me, reach out to Tyler, reach out to Brady. Go to pharmacypodcast.com and go to our contact section. Let us know that you'd like to be featured. It's you that make these conferences and our press coverage so interesting. We just got done with APHA. We'll be coming out with a third part of that segment. And, you know, we could not do these programs without the support that we get from organizations. And it's Lumacera that's going to be one of our sponsors. And I'm so excited to be working with them. This is not the first time that we've worked with them. They've also had representation on the Pharmacy 50 most influential people in pharmacy. And one of those people that I'd like to welcome to the show right now is my friend, Ben Heiser. Dr. Heiser, welcome to This Week in Pharmacy.
Hey, Todd, good morning. Happy Good Friday to you. It's hard to believe that it's been almost a year and a half since I was able to visit your really cool studio out there outside of Pittsburgh and talk for the first time about what Lumicera is up to in the industry. And obviously, as you mentioned, we've had lots of time to chat in between that and, being involved in the podcast here, but then also being recognized within that influential 50 pharmacists each year here, a variety of our team, which is really, really great to see the recognition as to what we're doing in the industry, specifically within specialty pharmacy, to really, help change the industry, help move it forward in the right way. So thanks for having me on. I look forward to our discussion today and certainly our ongoing discussions while we're out at Assembia, as you highlighted.
Absolutely, absolutely. And Lumicera Health Services has really expanded. Your role has expanded. You're general manager now since when you first joined the organization. And the website really has also changed and morphed, and you're adding services. The quote I really like on the website is lighting the way to a healthier you. In the realm of specialty pharmacy, I don't want to say that other facets of pharmacy aren't as important, because they definitely are. It's all about the individualism. But when you're talking about specialty medications, you're talking about the expense, you're talking about the titration from one medication possibly to the next, or one dosing to the next, in collaboration with physicians and testing and labs. And I mean, I laugh when I see different quotes come out about specialty pharmacy on social media about, oh, it's specialty. Is it really special? And I'm like, oh, goodness gracious. If you just maybe took time to go to Assembia and just talk to a bunch of the people, like, it's an entire universe within a universe of pharmacy. And I'm proud to be part of it. We're a tiny part of it in covering it, but Lumicera is a special part of it. So tell us a little bit about what Lumicera has been up to.
Yeah, thanks, Todd. You're right. I think, what do they always say? Life moves fast. Well, if life moves fast, specialty pharmacy moves faster. So it is constantly evolving. And as you mentioned, Lumicera has been around for 11 years now. I've actually, today is actually my 10th anniversary with the organization. So it's been a great 10 years and growth there. And like you mentioned, my role has changed. I think when I came on, we were doing just maybe a couple dozen shipments a day, maybe up to 50 even. And I think I was associate number 7 in the organization. And now we're going to be over 400 employees. And, on normal days, we're doing 1,500 to 2,000 shipments out and having that large of an impact on patients. And prior to coming to Lumicera, I actually was in retail pharmacy, a combination of retail pharmacy and long-term care. And I think even then, before I moved into this industry, I didn't really understand what specialty pharmacy was, and kind of what the mantra is out there is, what's so special about specialty pharmacy. I think once you move into the industry and you see all the intricacies and the coordination and the knowledge that it takes to really make sure that you're taking care of these patients, it really opens your eyes. And similar to you, as you mentioned, you see a lot out there as to, again, why is specialty pharmacy any different than any pharmacy? And I certainly recognize that every single pharmacist out there and person that's involved in pharmacy has similar background and training, but it really just comes down to experience in dealing with these medications that can be completely, high touch, complex, difficult to navigate for patients. And that's where I think that's one of the best things I love about what we do at Lumicera. It's taking this incredibly complex process, which for people who are not involved in this and patients that are new to this, it is incredibly overwhelming to navigate through the process of even getting onto a specialty medication, getting that medication approved for payment through the insurance, and then having to work through the process of actually being able to afford the medication, let alone all the clinical that goes into it, the monitoring, the side effect management, the proactive prevention of side effects, and the ongoing care. It's just a maze to navigate. And what I love about what we do is we try to simplify that as much as possible, certainly for our patients, but we also have amazing partnerships with our providers because we do such a nice job of making the job easy for them too. Because what a lot of people don't understand is it's hard for prescribers to navigate as well. it's not as simple as sending a prescription off to the local pharmacy who may or may not have ever seen that medication before. They have to navigate that process as well as getting that approved. And we really make that easy for them too. So it goes seamlessly from initiation of care, diagnosis, and patients on therapy as quick as possible. Our average patient receives their medication within 3 days of the time that we receive it. So we're very proud of that. And as I certainly understand, there is a lot of scrutiny around our industry, primarily because of some of our competition and the things that they do. We kind of sit back and say, well, we're trying to do this the right way. And ultimately, the patient is at the center of what we do and taking care of them. So,
yep. And care and process and administration are two different things. So when I think of pharmacists that are dialing into complex disease states, and we know that the primary medication is the X medication, whatever it is, and then with X comes an ancillary medication or a blood pressure medication or a vitamin or some kind of supplement or a protein shake or something that the pharmacist who has dialed in and has 2, 10, 20 years of experience of oncology, and they know what the patient is going to go through. They're like, hey, listen, you're going to start out on this chemotherapy medication or this vlibliblanab. I can't say the nabs, Ben. I don't know the nabs. There's a lot of nabs out there. But it's one of these medications. And I know on day 7 or day 9, 80% of my patients experience this, or this. When a pharmacist is talking to their patient and they're dialing into what the future holds for them in this therapy, it's going to lower the worry of that patient, because the patient's like, hey, not only did my physician tell me what's going on, they handed me off to this pharmacist. This pharmacist knows everything. They know what I should be eating. They know where I can go for payment assistance. They know where I can go to get my family involved or counseling. And it's like the hub of healthcare is that pharmacist, that specialty pharmacist. That's what Lumicera is all about. And I'm so impressed with the added services that you've been putting on since I even first learned about Lumicera like 3 or 4 years ago.
Yeah, you hit the nail on the head. It's that expertise. It's that day in and day out managing patients with these disease states. I kind of like to tell the story again, going back to my days when I was in retail. And occasionally one of these medications would find its way to the pharmacy, and you'd look at it and you might not have ever heard of that medication, let alone understand, again, the process of getting that medication approved, but then finding the resources to help that patient manage the payment for that medication. 75 to 80% of the patients that use Lumicera have zero copay. Expensive medications, but our team knows exactly where to go to get the funding for that patient so that they can continue to take the medication at an affordable or free cost, so they can continue to be on therapy routinely to recognize those outcomes. And then, as you mentioned, the clinical, they're very, very detailed. Now, again, any pharmacist can go and find the resources, but what's particularly challenging in a non-specialty space is having the time. We all know that most specialty or most community type settings are very, very busy. You have many patients waiting. It's very, very quick paced. You might want to delve into a very, very detailed conversation with a patient, but then a line starts to form and people start to get a little bit frustrated. Then with specialty, patients oftentimes in the setting of their home, we have a nice consultation with them, and we do not time box our associates, meaning any of our associates, whether it's payment support, whether it's clinicians, nurses, pharmacists, they have the conversation that the patient needs. If a patient is well informed or maybe existing on therapy and it's a 10-minute conversation, great. If it's a 30-minute, I've personally, back when I used to help patients, specifically myself, hour-plus long conversations, because these are very, very detailed therapies. Like, to your point, it's not just taking the medication, it's all the things that go around it to make sure that not only is the therapy effective, but you minimize some of the very complex and detrimental side effects. The other thing is you mentioned we have pharmacists specifically that are in various disease states, so they see these day in and day out. Many people are certified in the disease states that they manage. It's some of those anecdotal things that are the most powerful. You talk to patients, you start to hear the things that they do to manage the disease state. It's not in the literature, but you can turn around and then start to mention to patients, hey, if you're experiencing this, we've heard over and over again that this is what patients have done to manage this side effect with great success. It's all those learnings and experience that really become valuable.
Absolutely. And then it's also some of the things that are attached to the bigger services that you have a portfolio that's expanding. I'm really excited about the infusion services side of what Lumicera Health is doing. Talk to our listeners a little bit about the expansion of Lumicera services and infusion services.
Yeah, it's just another way for Lumicera to reach more patients. We're all about our mantra is helping human beings. And we certainly have grown a ton, as I mentioned, over the past 10 years or so. We now care for over 50,000 patients at any given time, and it's consistently growing. We do core specialty pharmacy services both for Lumicera, and we also help support the specialty pharmacy services for a variety of different partners, kind of as operating in the background through their brand, because we want to help enable specialty pharmacy and help those health systems reach more of their patients. This was just another way of a very quickly growing portion of specialty pharmacy for Lumicera to not only reach more patients, but do it in the way that Lumicera does things through our core specialty pharmacy. And that is transparency and providing value back to the system with our cost plus pricing. There's really nothing within the industry from a specialty pharmacy standpoint that's anywhere near our size and scale that does it the way that we do. And we see infusion services as just another way to do that. We've been providing medications that have infusion requirements for a number of years, whether that's directly to an infusion center, to a hospital system, to a clinic. This is another way to help those patients who want to be able to receive those medications in home. So we go through the support of setting up nursing services, sending out the various supplies and those types of things. We have a number of partners as well that are interested in us providing these types of services. So it also works as a synergistic way from a business development standpoint to have an additional offering for those partners as well. So we're rolling this out. We're actively doing this. Very, very exciting. And we see this essentially as an extension of Lumicera into the infusion space.
I love it. And it's a roadmap for other specialty pharmacies that really realize that there's an opportunity out there to serve people in their community who need these infusion services, because that would become nerve-wracking for me if I were a patient or if I were a parent of a child that needed infusion services. I'd be like, where do I go for this? I'd probably call my hospital system first and get lost in a triage of being bounced around to different extensions. And Lumicera is that hub. You're coordinating with the patient, with the nurse, with the person that is in charge of getting the equipment there, with the physician. Like it's just coordinated care that comes through. That's why specialty pharmacy is called specialty pharmacy. It's not your average Joe, community pharmacy. And community pharmacy is so important. I love all aspects of pharmacy. However, specialty is a dial-in. It's much more precision driven. It's much more customized. And a shout out to physicians if you're listening. To shout out to our health plan organizations if you're listening. Reach out to Ben. Reach out to Ben and his team. Ask questions. Pose very specific situations. Ask the team, how would you handle this, or this? But having a specialty pharmacy in your corner that really understands not only specific disease states, as you were saying, Ben, but the intricacies and the complexity of the medication management in general, especially with how expensive these things are. It's not like an antibiotic that we can lose a couple of the tablets and everything will be okay. This is life or death at times, day to day, and dosing and keeping up with the medication and double checks and ongoing phone calls and ongoing meetings. It's a special facet of pharmacy. That's why they call it specialty.
It is. As you hit on the word coordination. And as you were saying that, I'm like, it really does. It boils down to the coordination and getting everything lined up the way it's supposed to across from prescriber all the way through it. And the other area that we really coordinate with is our manufacturer partners, because obviously it's in their best interest to make sure that their medications are working the way that they should be. And if the pharmacy is not providing the services needed, the education needed, the follow-up needed for patients to be successful, it's not really benefiting certainly the patient, because now they're going to be bounced across therapies or has a variety of different downfalls of not having successful therapy. but the manufacturer themselves is interested in their medication being successful. So we work with a variety of different enhanced service programs, basically additional services, education programs that we provide on behalf of our manufacturer partners, that there is data behind that shows that there's even more valuable outcomes based on, again, these coordinated services. So coordination is the theme. Yes. Excellent.
Excellent. Well, I'm excited to be meeting up with your team at AXS25, Asembia 2025. I know that you won't be able to make it. We're saying prayers that your recovery to your knee will be okay and upcoming of what you're going to be going through. But we can't wait to have you back on the show. Let's talk about the future of specialty pharmacy and the future of Lumicera. But thank you so much, Ben, for being here today.
Yeah, I'm incredibly disappointed. Asembia is my favorite conference. You hit at all the great things that happens at Asembia. My wife can attest that I've been sulking around the house because I just recently injured my knee and not able to make it. But I was looking forward to speaking more about this. We have a ton of really, really cool announcements coming out. We recently had the announcement of our biosimilar partnership with Teva come out for that. And there's more coming. And I'm really hopeful that Eric Huckins, our Vice President of Business Development, that's going to speak with you directly at Asembia, has the opportunity to share some of those partnerships that are just continuing to push Lumicera forward and allow us to take care of more human beings. Outside of that, again, I love Asembia. I've been going for a number of years. It is the hub to be able to connect with all different stakeholders in the industry. And that's why I'm incredibly bummed, and I'm going to have major FOMO sitting at home recovering from knee surgery while you guys are having a great time and networking out in Vegas. I hope you have a great time, and Lumicera appreciates what you do and can't wait to speak with you out there.
Absolutely, and we'll have a great interview from the Lumicera team while we're covering the event. If you'd like to learn more, please go to lumicera.com. That's LUMICERA.com, lumicera.com. Ben, can't wait to have you back on TWIRx in the near future.
I look forward to it. Again, fast moving, so who knows what we'll be talking about when that time comes.
All right, we'll talk to you soon. Thanks, Ben.
Take care, Todd.